We have more than 300 members caring for 400 severely disabled people at the Stockton Centre, less than 2 kilometres from the coal loaders. And they are all at risk every time the wind picks up the coal dust. And just think, every day a tonne of coal dust is put into the air around Stockton. And those people who can't move, who live their lives there at Stockton with little choice, are subject to this imposition of coal dust, whether they like it or not. But they are just part of a very large, vulnerable community. Dust diseases are cumulative illnesses, with long-term exposure a major factor. Children growing up in harm's way and long-term residents, such as the disabled, are clearly at risk. Nurses and midwives are passionate advocates for the prevention of disease, including through living in clean and healthy environments and the provision of quality healthcare. We actively lobby for evidence-based healthcare policy and healthcare service delivery. The consideration of the health impacts of proposed developments in the assessment of development applications is a vital aspect of this. 120 million additional tonnes of coal per year, adding 52 additional trains with 90 uncovered wagons per train in and out of the port every day is a massive increase to the already identified risk and damage that is done now. One of the jobs of government is to protect the population and the voters from unacceptable risks. In this respect, the current New South Wales government is failing the residents of Newcastle, who are falling through the cracks of laws and government policies that seem to be geared to the maximisation of corporate power and profits without considering the long-term costs to population health. The O'Farrell government seems to be very keen on cost saving, yet it does not take the obvious step of addressing preventable diseases. As we all know, prevention is better than cure, especially given the types of diseases caused by coal dust are not curable. Any economist worth their salt will tell you that a population that is beset by chronic diseases does not have optimal productivity. This is not good from either the perspective of containing healthcare costs nor the corporate bottom line. And just think about this. The inhalation of the coal dust in the area is equal to forcing every single person to smoking 1 cigarette a day. We wouldn't normally choose to do that. So what we need is immediate government action based on evidence and sound policies, and not based on the false gods of ideology of profit before people. And sadly, development applications are not thoroughly assessed on their health impacts, and there is a lack of consultation with health experts and agencies during the assessment of proposals. In considering the T4 proposal, we understand that New South Wales Health and the local health district was not adequately consulted. This is despite the existence of ample evidence that coal dust is bad for health and how these health impacts are not confined to miners alone. And as we'll shortly hear from Associate Professor Nick Higginbotham, not only is coal dust demonstrably bad for health, but government agencies such as the EPA are failing to take the necessary steps to monitor the effects of the existing coal terminals. The EPA's monitoring stations are located too far from coal transport corridors and loading facilities to be useful in accurately measuring dust. As the study commissioned by the Coal Terminal Action Group clearly showed, many homes are subject to dust levels that exceed standards on as many as 5 out of 7 days, and this was measured in Carrington, and these standards are being exceeded by as much as 80%. While industry provides some benefits to communities through the provision of jobs, goods and services, it is not reasonable for industry to pass the unacceptable risks associated with their operations onto unsuspecting local communities. These health risks have not been voluntarily and willingly accepted by the people of Newcastle and the Hunter. The coal mining companies, most of which are multinationals, must be made responsible for the risks arising from their actions. They must make their operations safe for the workers and the local residents alike. We call on the government to place a moratorium on increasing the number and capacity of coal terminals, at least until 1, the current exposure of the community to hazardous dust levels is fixed. 2, it can be guaranteed that the proposed expansion of coal loading capacity and increased transport movements will not cause dust levels to exceed standards. 3, an independent research is undertaken into the dust exposure and health impacts of adjacent communities. Number 4, the EPA installs a network of monitoring devices in the geographic locations that are subject to dust exposure and prosecutes any breaches of standards. And last but not least, those who stand to profit from the coal extraction and transport accept their corporate responsibilities to ensure that unacceptable risks to the health of the community are not imposed on nearby communities. Dust and health, not good enough, Barry.